Hello, doctors. Today I have learned the femoral triangle. So let me explain. The femoral triangle is a triangular depression on the front of upper one third of the thigh, immediately below the inguinal ligament. So femoral triangle, and here is the inguinal ligament, and this is the triangular depression. So let's see the boundaries. The boundary laterally the medial border of sartorius muscle. Here is the sartorius and this is the right femoral triangle. And medially the medial border of the adductor longus. And base is the inguinal ligament. So let's see the roof. Roof is always same for any triangle or anything. That's the first one is skin, second one is superficial fascia, and third one is the deep fascia. So in superficial fascia there are some extra points that contains the superficial inguinal lymph nodes, femoral branch of genitofemoral nerve, branches of ilioinguinal nerve, superficial branches of femoral artery, upper part of great saphenous vein. And deep fascia contains the cribriform fascia that covers the saphenous opening. So next one is the floor. Floor is the gutter shaped floor and contains the four muscles lateral to the medial. First one is iliacus psoas major tendon and pectineus and adductor longus, and its mnemonic that IPPA. I iliacus, P is psoas major tendon, next P is pectineus, and fourth is adductor longus. Behind that arteries, veins, and nerves, there are the muscles that represented as the floor: iliacus, psoas major tendon, pectineus, and adductor longus. So it is not seen here because of that contents of the femoral triangle. So next we see the contents. So femoral artery, femoral vein, femoral sheath, deep inguinal lymph nodes, nerves. So how should we remember that? There is mnemonic that F3 and 4 and L. What is that F3 and 4 and L? F3 femoral artery, femoral vein, and femoral sheath. Then next the N4 means four nerves are there: femoral nerve, nerve to pectineus, femoral branch of genitofemoral nerve, and a lateral cutaneous nerve of thigh. And L is the deep inguinal lymph node. So deep inguinal lymph nodes lies deep to the deep fascia and medial to the upper part of the femoral vein. And next in F3 femoral artery, veins, and sheath. Femoral artery has 6 branches, 3 superficial, 3 deep. And femoral vein at the base of the triangle, vein medial to the artery, and at the apex, vein is posteromedial to the artery. And it receives the great saphenous vein, circumflex veins, veins corresponding to the branches. And femoral sheath encloses 4 cm of the femoral vessels. It is so easy triangle to study, and it is a very high university yielding question. In this diagram, again we see the contains that the femoral nerve, femoral artery, and the nerves, and that the boundaries adductor magnus, adductor longus, and sartorius muscle, and the base is the inguinal ligament. In green color dot, that is the deep inguinal lymph node. Then we see the superior view of the femoral triangle. This is the superior view of the femoral triangle. That it contains the inguinal ligament, these muscles, from right lateral to medial muscles, iliacus, tendon of psoas major, pectineus, and erector longus. So this is circular, that is oval shaped femoral sheath that contains the femoral artery, genitofemoral nerve, femoral vein, and deep inguinal nerve. And outside of the femoral sheath, there is the femoral nerve. So, if you like this, please share, subscribe, and comment for next topic. Thank you. Very simplified.